Hi guys, thanks again for watching, and we're going to talk a little bit about some comments that were submitted. This one's going to reference basically the stigmatism with the cone of shame. Dun dun dun. Yeah, it has a pretty good name because a lot of dogs pout with it, so I completely understand it. There's a lot of names, a lot of terminology for it. Dunce hat, cone of shame, party hats is another name. I like party hat just because it's a little more optimistic and a little more encouraging than dumpy, crappy, blah. But yeah, so if you guys have those, usually we send them home for a reason. Whether it's a patient is licking something and introducing an infection because they're licking, their mouth is dirty, they lick their butts, their private parts, the floor, they lick everything with them. The dog mouth, cat mouth is not a clean area. So if you have an infection, say a skin infection, and the patient keeps licking it, what are they introducing? They're introducing all that bacteria, yuck, and nastiness into the wound, and moisture. A lot of bugs, bacteria, that's what I'm referring to with bugs, like dark, cold, dark, warm, moist areas. Well, moisture, infection, dark areas, usually because they're licking it, they're hairy, usually they're laying down, creates a wonderful environment for bacteria and infection to grow. So careful with that. We use them a lot with whenever we do skin incisions for routine surgeries, spays, neuters, all kinds of other surgeries. Sometimes it's so the patient doesn't traumatize themselves. People have gotten very creative with these. There are cloud collars. I don't think they always work well. Every patient is different. Some patients you can get away with them. In my experience, it's been older patients that you can get away with the cloud collars. But if they're active and young and they're just beating the hell out of those collars, cloud collars tend to pop. You tend to spend, they're a lot more expensive than the traditional cones. And usually they get to it and then you get a secondary infection, or you end up spending more money because you got to buy another cone or a party hat. And less ideal for you guys. There are soft cones. Once again, patient specific. I think they work well on a lot of cats. They tend to tolerate them a lot better. Dogs are very creative and little Houdinis, and they will push on little cabinets, corners, and bend them, push them back, and then they can get to exactly what we do not want them to get to. So they are very creative little Houdinis. It's just all about motivation for them. So make sure they're tight enough. I like clients to feed them through their actual collar. Now, if you can fit 4 fingers through your collar, 3, it is too loose, and guess what? That collar is not doing much because that dog can slip right out of it, and that means they can slip right out of the cone. So don't be scared to actually make it snug. As long as you can fit 2 fingers flat, you're not choking. It's okay. You'll be fine. A lot looser than that, it's easy for these guys to get them off. I've seen other clients be real creative where they didn't want to buy one. They'll try and make them, and they'll use pool noodles and cut them up and usually pass a rope through it. Sometimes it works. I see a lot of issues with those. They get them off, they get to the problem, they make a new problem that we did not previously have. Sometimes they are very creative. Remember Houdinis? Sometimes they don't get to it with their mouth. Sometimes I have a buddy that does it for them. Wonderful. Sometimes they rub on things, and they will rub on the grass. They will go to a corner of furniture and get to it. Sometimes they use their back feet, and that's a lot more tricky. If that happens with your little fur ball, then try putting socks on them, see if that'll work. Try little booties. Sometimes they are just really good at what they do, and they get it off. A lot of times we can manage it. If needed, touch base with your veterinarian, and we may just give them a little extra encouragement, sedation, and that'll usually help and get the trick done. So hope that was useful for you guys, and little tricks that sometimes owners do everything great and perfect, and they just have a problem child who is very creative. Congratulations. Other times it's just flat out compliance and the owners don't want to listen, and sometimes bites you in the butt a little bit. So be careful guys. Hope you're enjoying these. Thanks for subscribing to all of them, and we will catch you later.